Hello and welcome to our very first Combe Grove podcast, Combe Grove in Conversation. Today, Campbell and I are going to be talking about metabolic health, and we're going to be telling you how you can utilise metabolic health to help you be healthier and feel better every day. So my name's Dr. Rebecca Hiscutt and this is Dr. Campbell Murdoch. I'll let Campbell introduce himself.
Hi, so I'm Campbell Murdoch. I'm a GP with a special interest in metabolic health. I've been a GP for about 17 years, and for about 15 years of that I've been really focused on metabolic health because it can be really transformative to people's health.
Fantastic, thank you, Campbell. And my name's Dr. Rebecca Hiscutt. I'm a registered dietitian and head of programmes here at Combe Grove. As you can imagine from what we've said, both of us are very passionate about this subject. And we are looking forward to bringing you an introduction to metabolic health today. And at the end of this episode, for you to feel excited about metabolic health and feel confident that you could start to put something in place to begin your journey to a more balanced metabolic health. So I think a really good place to start is sort of just getting really clear on what metabolic health is. You'd be able to define that for us?
Certainly, yeah. So metabolic health is probably the most important health topic of our time. And the reason for that is the majority of health problems that people are experiencing now are related to poor metabolic health. But this phrase metabolic health, although it's being used more frequently now, there's not a great understanding yet of what that term actually means, even though it is the most important thing we should be focusing on. So the way I like to explain metabolic health is it's to do with how our body takes in energy, takes in food and drink and fuel. That goes into the body, we digest it, and then we need to put it into storage and then release it again at just the right speed, at just the right amount when the body needs it, and then burn that energy to power our body. And the body needs to do all of that for us to survive and thrive. But whilst all of that's going on, the body needs to keep everything in balance, in perfect balance, to maintain health. So really, the metaphor I sometimes use is metabolic health is the engine for life, and it really is the foundation of our physical and our mental health.
Okay, thank you, that's really clear. And so pretty important stuff. How would somebody know if their metabolic health was good or not good?
Not ideal, yeah. So probably between 8 and 9 out of 10 people's metabolic health isn't good in this country. The easiest everyday measure you can do is your waist to height ratio. So you measure your waist about an inch above your belly button, and if that's more than half your height, then that's a very good indicator, a strong indicator that your metabolic health may need to be improved. But actually, interestingly, from day-to-day work and hearing people here at Combe Grove that come here to improve their metabolic health, I think one of the things that many people experience is just not feeling very well. The kind of energy is not very good. They're feeling a bit fed up. Their body just feels like it's a bit at war with itself. So in some ways quite soft signs, but equally really important signs that are affecting people's quality of life. Then in my in the clinical work I do, there's some very obvious signs of metabolic health not being ideal, which is things like raised blood pressure, pre-diabetes, type 2 diabetes, heart disease, kidney disease, liver disease. Sadly, I shouldn't be smiling, but it's kind of covering all the bases. And then most modern diseases, so people that are fearful of developing things like dementia and arthritis and joint problems. And then also many people struggling with things like the menopausal symptoms. So menopause is an event that will happen for women, but I think many people are suffering from worse symptoms than they need to through poor metabolic health. So it's a really broad topic, but as we mentioned, it is probably the health focus of our time, which is I think why it covers so many bases.
And the things you've mentioned there, they really are covering so many different things that an individual, is likely one of those things to come up, or definitely somebody that they know, one of their loved ones. And certainly menopause, that's something we see here a lot. People's experience of menopause being exacerbated by imbalanced metabolic health. I love how you were talking about some of the signs of things being slightly off kilter, like feeling tired, sluggish, aches and pains, alongside those health markers that will often be picked up by a GP, like blood pressure, for example. That's really good to know there's sort of a spectrum of things that people might sort of get picked up from a health test that they've had, but also if people are aware of metabolic health and what we're talking about today, they can begin to sort of think, oh, okay, that might be me, and look into it a bit more.
It's really interesting, actually. So one of the reasons I got focused on metabolic health in my GP clinical work in the first place was, it's about 15 years ago now, and I was filing blood results like you do, late into the evening, 8 o'clock at night. And when people get their cholesterol tested, they also get a test done called triglycerides. But typically, that triglycerides test isn't focused on within standard healthcare practice. We tend to have more of a focus just focusing on cholesterol. Many people's triglycerides are high these days. So it was about 15 years ago, I'm just filing away results, and all these triglycerides are high. I'm just filing them, feeling a bit uncomfortable that I'm filing them, knowing they're high, but didn't really know what it meant. And interesting, I was off to bed one evening after a late night blood result filing session, and had my phone and had a thought, I wonder what causes high triglycerides. So I quickly went on the internet and Googled it, and within about 30 seconds I found the reason for it, which is something called insulin resistance, which is at the root of poor metabolic health. And then I had a flashback to a lecture at university I'd had maybe 10 years previously on something called metabolic syndrome, which is a condition that can be diagnosed with poor metabolic health. And following that, I actually had a sleepless night. I think I slept for about 1.5 hours because I was flicking through all these research papers.
So your metabolic health slightly imbalanced the next day?
My metabolic health was definitely imbalanced the next day, and I actually woke up after that 1.5 hour sleep thinking I'd gone slightly mad, because everything I just read and what I recalled from my university days made absolute sense. It explained at least 50% of what I was seeing in my GP work, and yet we were completely ignoring it. Fortunately no more. Fortunately it's now being addressed, but yeah, that's one of the other measures is triglycerides. Also, people come in looking at blood sugar levels, blood pressure, and interesting other signs people get, which they may not have realised why they're getting, like skin tags on the neck or armpits or groin, bits of pigmentation of the skin in the skin creases are all linked into this. And then even people who are kind of think they're fit and they think they're doing well, they actually can be feeling quite worn down, lacking energy. I know many runners that they're running, they think they're eating healthy, but they can't budge that belly fat. Or people that at 11 a.m. are massively dipping. They had their breakfast, and then 2 hours later they're on a massive nosedive and hungry. That's all signs of poor metabolic health.
And it's lean people as well, isn't it? So it doesn't necessarily make any difference what your body shape, what your body composition is. We can't necessarily know what's going on inside. So just sort of for people to be aware that certainly we have people at Combe Grove who are lean, as well as those who have more body fat, and metabolic health can apply to. That's right.
Yeah. In my clinical work, I don't like focusing on weight as a focus. I think it gets too much focus. For some patients, that's their focus, and that's fair enough. But actually, metabolic health is not weight centric. It's about being healthy on the inside. And there are some relatively sort of straightforward but revealing measures you can do to get an idea of where you are, and then rapidly change it, which is the important bit.
Exactly, and one of the things that we love to do with people is get really clear on why they want to change their metabolic health, what difference is that going to make to their life and what they can do, and then once people are really clear on that and start making these changes, some things they can change, they can see instantly, can't they? They can feel the benefit that day, some of the differences in how they feel, their energy, for example, and then some of these markers change quickly. And then as they change these markers and the metabolic health becomes more balanced, well, weight often will change as a result of that. So for people who, weight is one of their, I guess, focuses, it just becomes a very happy side effect of rebalancing metabolic health.
Totally agree. I think I always think let's improve metabolic health, and the weight loss, or sometimes I like to use the word weight correction, comes along for the ride when you get things right. And maybe thinking of a recent person I spoke to, we're working with here through Combe Grove, struggling for many years with her health and off work. And after starting in a metabolic health improvement program here, within 1 week, she said, I'm now sleeping the best I've slept, more than 7 hours. I've got more energy. I cannot believe I'm not hungry. And then as a nice side effect, I've lost 11 pounds in 1 week, which I thought sounded a bit, okay, that's an initial loss you sometimes get, but it's going to slow down. I then heard from her again another week later, so that's 2 weeks, she'd lost 15 pounds and was still feeling fantastic. So as you say, this is about focusing on health on the inside, feeling better extremely rapidly, as you just heard. Within days, people are feeling better, and that weight loss and waist loss comes along for the ride. And she just mentioned, actually, just because of my clinical work, medication. So many people, certainly on diabetes medication or blood pressure medication, we need to obviously monitor what they're doing and adjust the medication appropriately when they improve their metabolic health. But within days, people are reducing their diabetes medication and often coming off it within days to weeks.
Amazing. And that's so wonderful, because often it's the exact opposite, isn't it? People, their medication creeps up and it's one more thing and then one more to help with the side effects of that medication. And I think very often when you speak to people in clinical practice and when we speak to people here, what they'll be talking about is, I've been feeling this way and these various things have been cropping up through the years. And they've begun to accept that that's inevitable. They think this is the norm, this is what happens when you age. Actually, all my peers are feeling the same way or similar. So they think that's just what they need to expect. And what's lovely is having these conversations about metabolic health and for people to know that isn't how it has to be. There's huge hope, and every single person can improve their metabolic health, no matter where they are. Just depends how quickly and how far they get, but every person. So that's something I know you and I share, that love that people can sort of take back control of their health and do something to change it really quickly.
Totally agree. So my 3 points was it affects all of us, it's measurable, and it can always be improved. Yeah. And sometimes as well, you don't know how much improvement somebody will get, but it's always worth taking that step. Just another person I spoke to last week, I'd seen 2 weeks previously, and he was retired and extremely worried that he was developing dementia. This was his first time coming in, but recognised he's getting forgetful and worrying how his brain was functioning, couldn't remember people's names. We did a quick assessment to see, kind of a screening test to see if there's any signs of dementia, and he scored okay on that. I looked at his notes and there were definitely a few signs of poor metabolic health. He almost had pre-diabetes, his blood pressure was up, and he was carrying a bit of extra weight around the middle. So the approach is with these things, well, I can't promise we can change all of these, but let's take a metabolic health focus for at least a few weeks and see what happens. So then catching up 2 weeks later, he had lost 11 pounds in 2 weeks. He said his brain was completely functioning normally again. Wow. He could think clearly, felt wonderful, wanted to share his story, which is why, anonymously, I'm sharing it now. But what was also wonderful, his family had now got on board. So I didn't dive into their changes, but he volunteered. His wife had lost 6 inches off her waist in 2 weeks, and his daughter, who got a chronic neurological condition, had also made some changes and feeling the benefits already. So it's, as you say, you mentioned the word hope a moment ago, and I think that's the lovely thing with metabolic health is no matter what else is going on in life and the uncertainties that life throws at you, metabolic health is something you can really hook onto and create a positive, hopeful focus in your life. And as you said, know that it can always be improved. Yeah, absolutely. Fantastic. And that's the other thing I think is worth mentioning is you were talking about your patient who had such an improvement in how his brain was working, and you weren't quite sure whether metabolic health was playing a role. And that's the thing, isn't it? It's invisible. Often for years, people aren't aware because our bodies are so good at maintaining homeostasis for as long as they can. And they sort of keep adjusting, don't they, and keeping things right, or they seemingly all right on the exterior, but actually underneath, our body's working really hard. It's fighting to maintain that balance. Very much so. And I think, I guess linking this, why is this such a focus now? So many people are living a life, often not intentionally, that's challenging and damaging to their metabolic health. And as you say, the body's pretty resilient. It will cope with that for a while, but the pieces start to fall apart and people are slowly getting a bit sicker and almost accepting that as normal, as you mentioned. and the body's really at war with itself, and that has a lot of knock-on effects. So another statement I often make is if your physical and or mental health are not as good as you'd like them to be, then try improving your metabolic health and see what happens. And conversely, if you find out your metabolic health is not as good as it could be, maybe you've had a health assessment and noticed some markers are a bit out, then probably you can reflect that your physical and mental health aren't as good as they might potentially be. So coming from both angles, it's an important thing to focus on if you want your best life.
I love that. Yeah, life without limits. So what might be really nice for us to talk about is, what people can do if they're thinking, oh my goodness, that sounds like me. I can appreciate those symptoms. What can they do? So at Combe Grove, we have our 5 routes of metabolic health. So we focus on nutrition, movement, sleep, environment, and mindset. So by making changes across each of these 5 routes, and particularly by doing this in unison, so doing this together, we have really powerful impact on metabolic health and rebalancing it quickly. And it is important putting them together, isn't it? Doing these, thinking about each of them. It might be starting with one, but then thinking about all of them because they interact. So what we eat impacts our sleep, how we sleep impacts what movement we do the next day, etc., etc. And some of these things we don't appreciate how much impact they're having. So for example, with environment, sometimes we're not aware of quite how big an impact our environment's having, and maybe things that are making us stressed, or the people around us, and all these things really have an effect. Wonder what you feel is maybe the most helpful place for someone to start. What can I do today?
Yeah, I think as you mentioned almost nearer to the beginning, what's important is people knowing why they care. There are many drivers in this world trying to take us in the wrong direction, so you need an emotional why and what matters to you. And then it's actually slightly challenging to give you a straight answer because everyone is so different, but as you mentioned, there are these particular areas that need to be focused on. Nutrition is quite a big focus, and reason being is I think for many people their food choices, often came through no fault of their own, often maybe through something they mislearned, is often quite a big focus. And a very simple step is just thinking about the amount of ultra processed food and sugars and things you're eating, and maybe bring that down. What we don't want to underestimate though is the power of making those effective changes that work for the individual. This isn't about some nudges in diet and expect maybe in 20 years time you'll be a bit healthier. This is when you get it right for you, you know about it within hours often actually, but certainly days. Measures are changing, how you're feeling changing. And then there are other simple things that people need to do. Often it's making sure they're building some muscle through the day, building that sleep routine, making sure they're at least getting opportunity for adequate sleep. Even if they don't sleep through the night, that's okay. Are you giving yourself the length of time overnight that you could sleep? And importantly, I think what's wonderful with Combe Grove as well is connecting with people that are going to support you on this journey. The world out there can sometimes be quite tough, or relationships might not be ideal, but a place like Combe Grove, everybody's on your side and on a similar mission really, which I think makes an enormous difference. And you also mentioned environment as one of the 5 routes. As I've mentioned a couple of times just now, the world can try and sometimes take you in the wrong direction. What I love about here at Combe Grove is it's very hard to not go in the right direction because the food available is right, and there's easy access to a gym. There's a great vista. It's a really nice natural environment, isn't it, with great views and woodland, which makes all the difference. The take home for me, this is an improvement journey. Get it right, you'll get results, you'll have a better day today and a better future. When you get it right, everything gets better. There's no suffering. It's about feeling well, more energy, and a brighter mind, and a body that looks after itself. Love
that. And all we're trying to do is bring the body back to balance and let the body do the thing that it does so beautifully. So it's almost just getting back to nature, getting back to balance, isn't it?
Yeah, absolutely.
Maybe like to finish by asking you, what do you wish you'd known when you were 20 years old? Is there something you think, oh, if I'd known that then, it would have made such a difference, either to you personally or in your work?
I think probably in both. It was the simple message, most important message has been what the human body thrives on food-wise. We've had about 2, 3, 4, 5 decades of information that kind of steered us towards probably less protein in our diet, more refined carbohydrate, and a real focus on it's all about calories. And that was never getting results with my patients. That approach didn't work. People's diabetes got worse. And then from a personal point of view, I love running, and I was running marathons, but I didn't feel good all the time, and my body composition certainly wasn't looking after itself. So that awakening, that actually going back to probably what we knew 60 plus years ago about how we should eat, is just miraculous. It just transforms people so rapidly.
Thank you. So I think it's a really good place to finish, is that there's huge transformation available, and I hope you're feeling really hopeful about where your health could be, and enjoy taking steps to improving your metabolic health.